So I think it's helpful to frame a little bit the different roles that community health workers do play, as Madeline's saying. And this is part of what we looked at in this rapid review, was saying, okay, what's that continuum that community health workers play? So there are about 20 countries of the 75 that we looked at who have, at one time or another, had community health workers who have actually administered vaccines. About 18 of those through injections and 2 where it was only oral. So it's a small number of countries. And I think even more important is, of those 20, less than half of those are actually operating at scale. So we looked at anyone that had ever done a pilot, had ever done something in a single district, something testing this model. But there are very few countries that are really doing this regularly, routinely at scale. Malawi is one of those, and that's a place that Village Reach has worked for a number of years. And, what we see is there's a real opportunity here. We know we have a shortage of healthcare workers. We know, as all of the panelists talked about earlier, that community health workers are uniquely positioned to identify that, as we often talk about in the immunization space, that fifth child. The 20%, it's a little less than 20% now, but it's a persistent 20%, at least as long as I've been working in the immunization space. We've been talking about that fifth child. And community health workers are really uniquely positioned to understand, as Alex said, this isn't, there's not a single reason. It's really, there are very many local reasons why, and community health workers are well positioned to find those. And so if you can actually equip community health workers with the skills, the knowledge, the supplies, and of course, the remuneration that they deserve, then, you can utilize that as an extension of the workforce to go out and actually reach and vaccinate children. And you see that happening in places like Malawi, Ethiopia, a number of other places where it is happening. But it's also important to say that there's another level in that continuum, which is also incredibly effective that we've seen. And that's where, and Maureen talked about this a bit, where community health workers, maybe they're not giving injections, but they have a very clear and active role in recruiting, discussing with families the power of vaccination, addressing specific questions that families may have about vaccinations, understanding the vaccination schedule, understanding, in more detail what a really strong immunization program looks like, and then linking those families to mobile or clinic-based services. We fundamentally believe that if you build a strong primary healthcare system that reaches the hardest to reach communities every day, that system will respond better to shocks and stresses and strains. And this is exactly what we saw during the pandemic.